Hi everybody and welcome to this Community Pharmacy West Yorkshire Connect event about environment and sustainability. Great to have you join us, either those that you are here in person or those of you that are watching this at a time that suits you on the recorded function. I would like to, just before we start, remind those of you on the call that of a couple of kind of Community Pharmacy West Yorkshire matters that to consider. I think one key one, and the key message from us is that I hope you've all seen that the RSG, the Review Steering Group, is sent out a proposal about how we move forward with community pharmacy representation. So that's both PSNC and LPCs. The proposal's out there for you all to have a look, and the voting will be opening at the end of this week. So really important you have a look at that, and as a contractor that you do cast your vote. So that is the kind of business dealt with. So on to tonight's event. So I'm really pleased to welcome Costas. Costas works for Bradford CCG. He's one of the medicines optimization leads, but he's also chair of the Pharmacy Sustainability Group. And I'm sure Costas might kind of give you a bit more information about what that group is. So a big thank you to start off with to Costas for coming. And I think without much ado, straight over to you, Costas.
Thanks, Ruth. I'll just share my screen. Okay, so yeah, as Ruth mentioned, I'm a pharmacist in Bradford District and Craven, and I also chair the West Yorkshire Pharmacy Network for Sustainability and the Environment. That was a group that SAN recently formed, and it's bringing together pharmacy representatives from different sectors and different organisations in West Yorkshire, and it's starting to be a bit of a collaboration of how we can all work together in the sustainability agenda, which is really emerging in pharmacies. You'll see through the presentation. And one of the early things we wanted to do was do some introductory talks to pharmacy teams across West Yorkshire, just to cover those basics of why this is important, how it links with pharmacy. So that's what we're going to do today. Okay, so just a quick overview. There's about 15 minutes of introduction on the environment and healthcare. And then we've got about 15 minutes on more focused topics and interventions on an introductory level. And then we've left some time at the end after the presentations to allow for some discussion between us all, because we're really keen to kind of hear how people are finding sustainability kind of in the day-to-day jobs. Are the things that could change, any ideas of things that could make pharmacy more sustainable. So we wanted to leave a bit of time for a bit of peer discussion or Q&A at the end. So that's kind of the overview of the hour. And going into the presentation. So I'm going to start with a real life example. You may have seen this article back in December 2020. Ella was a 9-year-old girl with severe asthma, along with other health conditions, and she sadly died in 2013. She lived near London's South Circular Road, where air pollution was beyond legal limits. In December 2020, for the first time in the UK, it was recognised that air pollution was a factor in her death. I think one thing that's hard with this and climate change in general is, I'm sure most of us will drive a car at some point, and our everyday actions have impacts on the environment, including those we do at work, even if we're doing them in order to help people. I think that's why it's quite a difficult problem, and maybe why people at times can find it quite hard to engage with the topic. But if we have an effect on the environment, we have an effect on the people and living things within it. But luckily that works both ways. We can have positive effects on the environment and we can reduce our negative effects. And I feel that's the best place that we can focus ourselves. So unfortunately, the effects aren't evenly distributed in society. Socially disadvantaged groups are disproportionately exposed to poor environmental conditions. And that's kind of linking in with the wider inequalities agenda. You can see here, it's a real simple visualization, but we've got an area of central Bradford, and we've also got a suburb of Bradford. And if you look at those, it's kind of thinking about the immediate environments those patients interact with on a day-to-day basis. You can see how different it is. And as little as 2 hours a week out in green space and nature has shown to be beneficial for your well-being. And so you can see it is quite a stark difference when you kind of think of that.
Costas, can you move your mic a little bit further away from your mouth? You get a little bit of kind of noise, sorry.
Yep, is that better? Thanks. So one thing I'd like you to take away from today is the environment and the wider effects of climate change is a clinical topic. This diagram in the center there, it's got the cycle of climate change that we're seeing. In the middle ring, it's showing like the environmental results of that. And then the outside ring is showing the impact on human health that they can have. I can pick a couple out just as examples. So we mentioned air pollution at the beginning there, and about 40,000 deaths a year in Britain are linked to air pollution. There's strong evidence that air pollution causes development of coronary heart disease, stroke, respiratory disease, lung cancer, and can exacerbate asthma. Like pre-pandemic, 1 in 20 UK road journeys related to NHS business. Another example on there might be severe weather, which we're seeing more of. So you may get direct injuries from like storm weather, but there's been kind of studies that show there's like a lasting mental health impact of people losing their homes to flooding, and we see flooding in West Yorkshire, which I'm sure you're aware of. And there's also things like increasing forest fires across the world and putting people's kind of homes at risks. So there isn't time to talk about all of these, but I'm sure this slide kind of gives you ideas of kind of the health impacts that are happening or can be increasing. But generally, the better health that we can keep the environment in, the healthier the people within it will be. And if we're not taking action, these kind of effects will be increasing. And I think it's important, especially with some recent major events that there's been in the world, kind of thinking about how dependent we are on the whole world's population. And if some of these things aren't actually affecting us, they may be affecting other people in the world, how dependent we are for things like food supplies, medicine supplies that all come from different places. So it's important we have like a whole kind of world population view when we're thinking about climate change. Another factor to think about is if we have a worsening environment, it's going to reduce healthcare's ability to deliver healthcare. So we're going to have an increased need and a reduced ability to meet that need. Kind of examples maybe in a care home, they're vulnerable to things such as heat waves. And there's a really high proportion of healthcare settings in the UK that are at risk of flooding, especially from surface water flooding when we get an extreme kind of downpour or heavy weather for a period. Plus you have to think about delivery routes, maybe at risk of flooding, staff in homes. So all of that added together can really limit healthcare's ability, and needs a lot of adaptation planning of how we can meet those risks. And for example, in 2020, we had 3 heat waves during the year, and they're thought to represent over 2,500 deaths because of those heat waves. So it kind of puts into perspective, these are already kind of seeing quite significant effects without us kind of projecting all the way forward to years like 2050, etc. So it's something that's happening now. And that's why there's a growing interest from healthcare professionals trying to promote the environmental agenda within healthcare. There's numerous organisations now to support us to take action. There's many colleges now and leadership bodies that are declaring climate emergencies as they recognise the risks, including all our West Yorkshire councils have done that. And our West Yorkshire ICS is aspiring to be a global leader in responding to the climate emergency. You'll see at the bottom there's now Pharmacy Declares, and they've been really successful in working to ask pharmacy leadership bodies to declare emergencies, provide leadership in this agenda, and stop their investment in fossil fuels. It's a really useful network to be a part of. If you have got an interest in sustainability or want to know more, you can network, share resources. And you can kind of follow them on Twitter if you want to get updates, or they've got Telegram groups for networking. And so far in the kind of the past year or so, they've helped to instigate declarations of climate emergencies in bodies such as the UK Clinical Pharmacy Association, Association of Pharmacy Technicians, the Royal Pharmaceutical Society, Primary Care Pharmacy Association, and the Pharmacist Defence Association. So you can really see that momentum is growing in pharmacy, where this is being recognised and beginning to see that action's needed. So as I mentioned, the Royal Pharmaceutical Society declared a climate emergency. They've also committed to stopping investment in fossil fuels during 2022. And they've got a pledge campaign coming up this year, so we can all kind of get involved with showing what actions we're taking to help this agenda. You'll see on their website, they have sustainability policies, and they've kind of got 4 main headings there. And if you go on the website, you'll see that they've kind of recommended actions that either individuals can take or that need kind of policy change around these areas. So it's good to start seeing leadership from the RPS in tackling this. I'm sure you've heard of NHS Net Zero. In October 2020, the NHS became the world's first health system to commit to reaching net zero carbon, and it set 2 targets for that. Since they've done this, many other healthcare systems have signed up to do this as well. And the reasons they were doing this is the NHS carbon footprint approaches total emissions of countries such as Denmark and Croatia. The NHS has more than 1.3 million staff, which is one of the top largest employers in the world, and contributes to almost 5% of the UK's carbon emissions. So it kind of understands that responsibility and opportunity to tackle climate change and reduce emissions, and they can see how that can benefit health as a result of leading on this. And they split their targets into two topics. So there's the carbon footprint for things the NHS directly control. So they want to reach net zero by 2040, and some organisations want to do it quicker than that. And then there's carbon footprint plus, so that's influencing anyone who wants to work with the NHS. So things like suppliers, they're going to have set criteria that they have to meet in order to supply the NHS. So they're contributing to net zero, and they're looking for that by 2045. When you're looking through the NHS net zero information, they do kind of say that medicines account for 25% of the NHS's carbon footprint, which is a really high amount if you think about it, and just shows how important pharmacy is going to be in this. And the MDIs alone account for 3% of the health and care carbon footprint. While we're on this slide, it is worth remembering that carbon footprint is only one element of environmental effects. There are also things like water pollution, the long-lasting effects of kind of plastic being in the environment, things like air pollution. So when we're thinking about environmental effects, it's good to have that holistic kind of thought process, not just a focus on carbon, which can obviously be easy to do. So medications are the most common intervention in healthcare, and we've got to remember they have a whole life cycle to them. This is a very simplified diagram of a generic product linear life cycle. So things from extraction of natural resources through production, distribution, and ultimately some disposal. With medicines, we even have to think about elimination of biological substances, because about 30 to 100% of a medicine that can be taken could be excreted to the body and enter kind of sewage systems. One thing when you're looking at this is you have to remember each stage has its own environmental effect. And I'm mentioning this to try and move away from seeing things as the individual products in front of us to kind of considering that whole life cycle of products. So the issue maybe from a wasted tub of cream that maybe a patient didn't want in the first place, we might have said before it's a waste of money or a waste of people's time in that process to get it to the patient. But we have to think about the environmental impact of its creation, its packaging, its moving, its storing of it. just for it to then be burnt or left in landfill if there's no kind of benefit gained from that as well. So thinking about how environmental impacts can be improved, we can think about sustainable quality improvement principles to see how impact can be lowered. So one way is, in general, is to reduce activity, and it's kind of the activity that drives this process, and that's kind of that purple circle there. And these are kind of general thoughts around how you might reduce activity. So underlying everything we do needs to be best quality healthcare. The better health we can keep people in it, it's likely to reduce their healthcare needs. So that's really important in everything we're doing. We can think about things like leaner pathways of processes, pathways that patients go through, look at any reduction in wastage during supply. Things like preventative medicine's important, so there may be less environmental impact of a patient having a DOAC to prevent a stroke than having to support a patient after a stroke, plus all those patient benefits through preventing those outcomes. Patient empowerment, self-care and lifestyle interventions, we'll touch on those later, but along the same lines as preventative medicine. And then looking to reduce any unnecessary healthcare, and some kind of pharmacy examples of the work we kind of do to reduce adverse drug reactions through safety interventions, and stopping problematic polypharmacy, which we know can be quite common. Where kind of activity is the right thing to be doing? The other kind of arm of this is, can you lower the environmental impact of those interventions? So an example of this may be looking at lower carbon inhalers. We can start thinking about appropriate disposal of medicines. Can we reduce packaging? Can we have recyclable processes which can make this more circular and less linear? And things like our distribution methods. I know a few pharmacies are managing to invest in like electric vehicles to reduce the carbon of delivery methods. But one kind of key starter across the thing is everybody in the whole process of trying to have a pro-environmental attitude, and that will help us reduce some of the barriers and find solutions together, because this is something we all need to work on. So that was kind of a bit of general background. The next section is a bit more about some focused topics, and it's a brief introduction into maybe a few interventions that we can start to think of to kind of link our pharmacy practice with sustainability. And I think climate change as a topic can be quite overwhelming. Sometimes it's quite hard to know where to start, but it's worth remembering that we can all do something, whether that's a big intervention or something small. You know, every day we're getting those opportunities to look for different ways we can do things. But the important thing is for everybody, is starting to find what we can do now and start making changes.
Excuse me, has anybody got any questions at this point, just before Costas moves on to this kind of next section? I certainly find that really helpful, Costas, in that I think, you know, to put into context that in medicines are 25% of the NHS carbon footprint and MDIs are 3%. I think it just goes to show how important pharmacy is within this agenda. So really good, thank you. I don't think there's any questions, so I'll let you continue. Thank you.
Okay. So the first part is around inhalers. So I'm sure it's kind of crossed your paths, the link with inhalers and sustainability. So as I mentioned before, MDIs alone are responsible for 3% of the total NHS carbon footprint, and it's a key early focus of the NHS Net Zero plan. Most of the emissions come from the propellants used in the metered dose inhalers rather than the medicine. And that's because they've got a high global warming potential. There are in development low carbon MDIs, but they won't be due until around 2025, and actions needed before then. So that's why you'll start seeing changes in inhaler prescribing patterns. There's a couple of kind of visuals here, difference here between a Ventolin and a smaller metered dose inhaler like Salamol. Because the Ventolin's got a larger volume, it's got more propellant, it does have a bigger carbon footprint, approximately about 3 times as much. And the visual there is somebody looked at the carbon footprints of the DPI and the larger MDI, and they've kind of converted that carbon footprint into miles driven. And it's a really stark difference when you look at it like that about how big of a difference the carbon footprint is. And again, just to balance things out, dry powder inhalers do have environmental impacts as well. So every inhaler needs to be used appropriately. It's just when we're trying to reduce our carbon footprint, the balance is to reduce meter dose inhalers where it's suitable. And it's important to note as well, we're talking about devices, but poor asthma control has got really significant environmental effects as well. So you're more likely to have higher SABA use, might need acute treatments on top of your long-term therapy. You may need more appointments or admissions, and all of those have their own environmental effects as well. So while we're on devices, kind of a simple counselling point, you may have already been doing this for your pharmacy quality scheme previously, but reminding patients to return all inhalers empty and full to the pharmacy so the gases, remaining drugs are incinerated rather than released in the environment. Hopefully down the line we'll get improvements in recycling, but we can start building those habits of getting medicines and inhalers returned to pharmacy for better disposal than putting them in your bin. And there's a link there about the PSNC have the patient briefing sheet on inhaler disposal, which has more detailed information. So thinking more about potential interventions, at the top there, I've put about best respiratory care and control is the most important factor. And the greenest inhaler really is the one that the patient's able to use properly and is effective. Nobody's saying MDI shouldn't be used. There will be patients where that is the best device for them. They can use them and they wouldn't be suitable to have a dry powder inhaler. So most importantly with the inhaler thing, can the patient use it? Is it effective for them? Things we can do is maybe check an inhaler technique. You may be part of the inhaler check service that can be available through community pharmacies. Hopefully you're able to link with your practices to increase use of new medicine service for that technique education. You will start seeing more prescribing of dry powder inhalers and soft mist inhalers as first line choices, but that should be where it's suitable for patients, and patients should understand how to use that device through the prescribing process or new medicine service. Make sure that they can use that inhaler. You'll see reviews of patients with high uses of SABAs and maybe referring to them more as rescue inhalers to kind of show that they're not for your routine use, that if you are using them a lot, that you do kind of need that clinical review. And often practices are focusing on patients who receive 6 or more SABAs, and high amounts of SABA use has been thought to be a key contributor to there being high levels of kind of asthma deaths when they've done the national review. So it's something to really be mindful of and to flag up if possible. Obviously, inhalers can be a product that people stockpile or there may be oversupply of, so trying to be mindful of that if you're able to spot that. And something that a trust raised recently, they realised that when patients were in hospital during admission, as they moved around to hospital, sometimes they were getting duplicate supplies of inhalers. So I thought it was worth a mention that maybe if people have been in hospital, they may have extra inhalers. So it's just something to be aware of the day to day. On the left-hand side there, you'll see there is the group called Greener Practice. They're a kind of primary care group, mainly GPs, but there are pharmacists and other healthcare professionals in there. They've built some resources around high quality and low carbon asthma care, and they've got a toolkit and a document, loads of resources through there, and they've all been endorsed by the kind of national respiratory networks. So really good to look out if you are interested in the respiratory agenda. Also on the West Yorkshire Healthcare Partnership website, there was a lunch and learn session done by Toby Capstick, who's a consultant respiratory pharmacist in Leeds. And again, a really detailed talk, a whole hour just on the respiratory agenda. So that's available if people are interested in that. I'm going to move on to antibiotics next. So antibiotics, as you can see in that picture there, they find their way into the environment, often same places as where bacteria are. And it's worth thinking when we take antibiotics, a high proportion of them can be excreted out into the environment, plus there's methods of them getting into the environment through the production routes and through kind of animal agriculture. And it's thought that failure to control antimicrobial resistance is predicted to lead to 10 million global deaths by the year 2050. And currently 25,000 people in Europe die each year as a result of infections caused by 5 key resistant bacteria. So it is a real important health concern, and it does link kind of to antibiotics being in the environment is thought to be a contributor. York University undertook a global study, and they looked for 14 commonly used antibiotics in rivers in 72 countries across the world, and they found antibiotics in 65% of the sites that they monitored. There have been antibiotics detected in the River Thames and both rural and built-up areas of Scotland, and so there definitely are antibiotics definitely getting out into the water systems. You can see there generally the top 5 antibiotics that are seen in water systems, obviously very commonly used antibiotics. So again, just thinking about interventions, with this one, the antimicrobial stewardship agenda and the environmental one really go hand in hand. So those things that we know about with the antimicrobial stewardship is kind of just reinforcing that, and maybe like the environmental message is another kind of tool in our arsenal when we're talking to patients and trying to kind of get behaviour change. It's another thing that maybe we haven't really talked about a lot of, and I think it's definitely getting some momentum in the antimicrobial kind of world about that environmental message. So things like antimicrobial stewardship, it's going to look to reduce overuse and any amount that's kind of available to be entering into the environment. The trusts are kind of supporting the IV to oral switches, as they always do, because you kind of think about in general an injectable versus an oral treatment, all the kind of consumables that go along with that medicine is going to have more of an environmental impact and carbon footprint. We can all champion antibiotic stewardship, things like antibiotic guardian campaigns, and start just bringing it into conversations with patients. So a very kind of simple message that maybe we don't always get to work into our routine discussions is kind of remembering that all antibiotics should be returned to pharmacies if they're not needed. Often you see on TV people flushing medicines down the toilet or something, and so just reminding people to bring them back to the pharmacy, not to put them in the bin, or maybe pouring part bottles of liquid down the sink. So it can be kind of a simple message to kind of get out there. And just while we're on kind of antibiotics, I won't go into it a lot, but thinking holistically, there's a high amount of antibiotic usage in veterinary use and animal agriculture. It does vary where your food comes from, but in the UK, over 30% of antibiotics used are for agriculture. And that could be double in other countries. So it's worth just considering kind of food choices and being aware of where your food comes from, etc. Because that all links in with this agenda in the environmental one. So you will have seen nationally there's the overprescribing report. So this is all about the problems of overprescribing, deprescribing, preventing wastage. Obviously, we could do a whole hour's talk on overprescribing, and we're just touching on it today to kind of just remind about that link of kind of overprescribing and wastage and that link with the environment. So it's been estimated about 10% of medicines maybe overprescribed. Think of 1 in 10, that is a lot. Between 30 and 50% of medicines prescribed for long-term conditions aren't taken as intended. And medicines worth over 350 million are wasted each year. And obviously that's been worked out historically, and it's had a financial kind of tag put on there, but what was the environmental impact of all those medicines that are wasted? So it kind of brings home there is a big scope to kind of start tackling this, and kind of it can make a big difference in like medicines use and that carbon footprint thinking of how much medicines represent. Obviously, this is something that a whole system has to do. So whichever sector we're in, through kind of medication reviews, patient contacts, it's always an opportunity for those patient-centered discussions about anything that may be inappropriate or not taken. And I know in kind of community pharmacy, you're really well placed to kind of, you may get told things by patients that they may not be necessarily telling the prescriber, and it's kind of those open discussions. And one thing, if you are having open discussions, is that's a really good kind of question to think about, is what matters most to that patient, and what kind of do they prioritize in their healthcare, and that can help unpick sometimes some really complex kind of medication regimes and what the patient really wants out of them. So it's kind of, yeah, thinking in your pharmacy teams about, do you feel comfortable about asking those open questions, having those discussions about non-adherence and where to go with that, whether that's intentional or not intentional. So this is about lifestyle and treatment. So lifestyle interventions that can reduce the need for medication by providing alternative management options, and also reducing that need for future healthcare. So supporting patients with lifestyle measures, and I know like public health messages are really big and really common coming through pharmacy. It can really reduce that need for healthcare and all those environmental impacts that go with it. So it's maximising what's within your power to kind of discuss with patients what are your common things that you're seeing, where are the common places you can offer for support. There does really need to be more kind of patient support around lifestyle to really maximise it, but it's such a beneficial thing. And you can kind of see this diagram at the bottom here. It's trying to illustrate that on the left hand side here, you've got your overweight patient that's inactive, has a borderline high blood pressure, and there may be like a drug option, could pick ramipril here, and that comes with its carbon footprint. It may have side effects. They may have to go to monitoring appointments as they have that titrated. And as you'll see, if you may not get as many benefits as maybe a lifestyle intervention in certain cases. So maybe the lifestyle measures could include increasing exercise, especially in nature, because then you kind of get some well-being benefits, plus you kind of building that relationship between people and nature. Active travel is where you're trying to incorporate exercise through your travels, maybe cycling to work. And obviously healthier diets would contribute to a lifestyle measure in this patient. And then you kind of start maybe seeing benefits through that, through maybe lower use of cars, maybe less carbon footprint. You can get improved emotional well-being, that exposure to nature, weight loss, and kind of other health benefits that you kind of that sprout from that, and maybe reduce use of health service eventually. So I know that's an ideal world, but it's just kind of reminding that huge role that lifestyle has got. So this bit's about disposal. And when I've kind of spoke about the environment with different people in pharmacy, I think we do sometimes, we have a lot of kind of counselling that we have to do, and maybe we don't always mention to the patient what to do with the medicines that they've got left over. So it's thinking about disposal routes and how to do that safely. So you can see the top left there in the World Antibiotic Awareness Week, they were promoting safe use of antibiotic disposal. Sharps are another one. Obviously, we don't want those putting in general waste, and the risk of sharp hazards and them being present in the wrong environments. There's a great poster down there at the bottom about not flushing medicines, real good visual of trying to keep them out of our water systems. And down in the bottom left there, that was from the Pharmacy Quality Scheme materials, just reminding that if all inhalers in the UK were returned for safe disposal, it shows that the carbon reduction, and it shows that that would be the same as a Volkswagen Golf being driven around the world around 88,000 times. So it's really good kind of messages, and it's just that reminder, the more we can get patients into the right kind of processes, it can just help stop medicines getting out into the environment where we don't want them. So recycling, it's quite a tricky one. So obviously when you think about environmental kind of interventions, recycling is on everyone's mind. And in pharmacy, it's quite difficult at the moment. There are a few schemes around, maybe like Bristol packs and inhalers, but they aren't kind of easy to access. They may have costs associated with them. So it's really a thing that it's kind of good if people are utilising them, but it's a real need, like a kind of a national push of how can we make this accessible to more people in the appropriate places so it's easy for patients to do, and it's fully kind of supported. So I think this is kind of definitely needs to be an emerging topic to improve this. Oops. So one kind of thing that you may have a discussion about with patients with or be asked about, there's the Novo Nordisk pen cycle scheme, which is another recycling scheme for the pre-filled pens that they do. This is in pilot for pharmacies to kind of be involved with, but I believe that's around, maybe I think it's Leicester, Manchester and an area of Scotland. So it's not within pharmacies where we are, but individual patients can sign up on the website and ask for the free post system for them to return their used pens to the company for recycling. And there's lots of information on their website about how patients do that, and they can sign up on there. So I thought that was worth kind of sharing. So although it's not the pharmacy version of it, there is some accessibility for it. And kind of finally, this is a hospital trust example in the Mid Yorks Hospital Pharmacy Department. I just kind of wanted to illustrate what they've done. They started by forming a pharmacy green group, and they got the kind of interested people in the department together, and they've been proactive in kind of asking people in their department what changes would they like to make. And they've also built up some relationships with their trust sustainability lead for a bit of expertise. And the group have begun to act on kind of departmental ideas, and each one on its own is kind of a small thing, but they all kind of add up together, like changing your plastic bags to paper bags, reducing ordering for paper BNFs, reducing paper printing. They did the audit and looked and identified the duplicate inhalers being supplied during admission and putting processes in to prevent that. They used to always pack down into a fresh white tablet pack, but now they reuse some of the boxes they're packing down from where that's appropriate. So you can kind of see the systematic kind of thinking of things that they can change. And I just thought that was, although it's not a community pharmacy example, you can kind of see within your teams that you can all kind of contribute ideas and try and think of small changes that you can maybe do one at a time that are manageable, and they all start kind of adding up. So I thought that was just useful to share. So just to summarise, hopefully from today you've seen the environment. Obviously it's a very personal topic. This affects all of our lives, but it's also a clinical topic in our work. Pharmacy is going to be key in reducing the environmental impacts of healthcare. I can really see this being an evolution of pharmacy and it coming straight into our core work as much as kind of patient safety or financial kind of aspects. Obviously, I completely understand everyone is very stretched at the minute, and it is hard to kind of look at adding new things in. So one kind of area to start is thinking about win-wins. So what are we being asked to deliver, and can we work in sustainability to it, or are we kind of signing up to any sustainability initiatives and kind of maximize them? And at least then we're trying to kind of get some momentum. And one thing kind of it's always useful if you kind of trying to think through a process is those sustainable quality improvement principles of, is there a bit of activity maybe we don't need, or is there a way we could do it differently to reduce that health impact? So just kind of coming back to that. And I'll just end on kind of something to think about next few days, kind of why does the environment matter to you as an individual? Everyone's kind of got different motivators. Personally, I get a lot of well-being from nature, so I really want to kind of preserve it and then enhance it, because I know how beneficial that can be for people. And I really want my children to grow up in a world where we've got a better balance between the environment and our kind of day-to-day lives. So they're mine, but please just think of yours, and it just helps you kind of keep that motivation to keep going. And we've obviously really kind of light touched on a lot of things today as an introductory talk, but hopefully you'll go away from this and maybe think about, is there one thing that you can maybe commit to doing differently after today? It may be through your work, it may be something personal, but hopefully start with one thing and keep adding in, and eventually you get down the line and you realize you've made a big difference from simple starts. Okay. So I'll stop sharing for now. We can just see if there's any questions, and then we'll kind of go into more of the discussion area.
There was one question in the chat while people think about anything they want to ask. Let me just scroll up to find it for you. So Amanda's asked the question, Costas, is there any onus on inhaler manufacturers to develop recycling schemes for their products?
Okay. So I'm not sure exactly on where people are at, but obviously there was things like the GSK scheme, which then shut down. And then there's been talk around kind of a joint pharma kind of replacement service, which hasn't kind of come to fruition yet. Obviously all kind of companies are now kind of beginning to be pushed to reduce their carbon footprint or offset emissions. So I could see things happening through there, but as far as I know, I've not heard of any kind of significant developments at the moment.
No, but yeah, as you said, I think there is some movement, isn't there, on that, and it's around you know, because they have to demonstrate if they're going to be providing products to the NHS. Hopefully they'll get hold to account as well. Yeah. Has anybody else got a question? Please feel free to come off mute and ask Costas yourself. No. So to go to your questions, Costas, do you want me to put into the chat so that people can kind of have that conversation? Because it would be useful if we could all have that conversation about some of the things that Costas asked us. Or do you want to put your slide back up? It's up to you. It might be better to put it into chat for you.
Yeah, chat would be perfect. So yeah, happy to have just an open discussion, because obviously, like I said, we have this network at West Yorkshire level, and I'm really keen to hear like community pharmacy kind of perspectives of the type of things that I put in these questions, or anything else you kind of want to discuss. So is it something that you kind of know about any pharmacy teams? Have you got examples of things you've done that you want to share? If you've got any ideas of things that you could do, and what are your barriers, or what would you ask to be changed to be more sustainable?
Hi, Costas. I think that was really interesting, actually. It's surprising how much of an impact pharmacy has on the environment. You don't tend to think about it that much. So it's quite, I noticed that when we started doing the PQS work as well, it made us think a little bit more about it at work, and we tried to look at what we were doing with our waste paper, because we have a lot of waste paper. We were already recycling our corrugated cardboard boxes, but we didn't actually realise that the bin that we use for those, we could actually put paper and normal card in it as well. So we've started separating those out now, and recycling those, which we weren't doing before. So that's
great.
Has anybody else got anything that they've changed in their pharmacy? Jenny, you're on. You don't to unmute yourself. I can see you, but I can't hear you.
Right, is that it? Yeah. Oh, yeah. Could you just say a bit more about recycling foil strips? How is it possible to do that?
Okay, so I was looking into this the other day, actually. Hopefully I'll get this all clear. So TerraCycle were recycling blister strips. They teamed up with Superdrug, and that's how that scheme was kind of running. But Superdrug have changed who they recycle with, so that kind of went away from TerraCycle. But TerraCycle themselves do have a scheme, but I believe you kind of have to buy a recycling box for them. I think it's £180 from what someone said recently, and it does fill up quite quickly, so there is quite a big cost in there, and then you can return that to them for them to recycle. I believe when it was more open, they used to have it open to kind of pharmacy departments in hospitals and things. I believe they got a bit overwhelmed with demand because it is quite an intensive process, I believe, and there's a lot of material out there. So it's kind of small scale, and I believe it's a kind of a charge to it at the moment. So yeah, it is an investment, it looks like currently, unfortunately.
Okay, so there's not a way that we can sort of do it ourselves. So.
No, I think you're right, Jenny, because it's you know, for a one box £180, knowing how much it's not sustainable. But Costas, is it okay if I share the conversation that we had as part of the waste meeting this week?
Yeah, of course.
So it might have been last week, it all blends in. Costas invited me and quite a lot of other people from across different pharmacy sectors to a meeting to discuss waste and waste medicines and how we can reduce waste. And we had a really good conversation. And one of the outputs from that meeting, we did discuss empty blister recycling. And we feel this is something which, you know, either it should be within the community pharmacy contract, and the NHS should provide us with bins that can be part of what we're funded to do and what we can be part of. Or actually, you know, is there a way that they can be put into the normal waste that we all recycle? You know, depends where you are as to how it works for your local authority, but we can all recycle through our local authority waste, so that actually they can be recycled that way. And so we all felt that was really important. So we're now going to work together as a group to try and pull together a proposal and see if we can get our ICS to approve that as a proposal, and then we'll send it, you know, higher to nationally, because these things are going to need some national input, but that's our plan. So really good conversations, and there was other things on that list as well that we felt we could have a really big impact if things change nationally. So really cognizant, but a good question. Thank you, Jenny.
Yeah, it's worth noting on that point that, like, especially RPS, they do seem to be listening. So the more people kind of raise these issues and highlight them, whether that's through social media or other channels that you've got, it is worth kind of just pointing out if you are reaching barriers like this and advocating for change.
Reshma, do you have a question for us?
I do. Sorry, I did try to put my camera on, but it won't let me now because I think I didn't select it when I started the meeting. What I've noticed in branches is when the EPS prescriptions are being printed off, it seems to print a lot more paper than when we used to actually get the green prescriptions from the doctors. And it seems to print several repeat parts of the prescription. Is there any way of turning that off, or it just produces so much waste paper?
So is that it's printing unnecessary pages as well as the ones that you actually need?
Yeah, so many.
I don't know of a solution unless Ruth's come across anything, but it's definitely something we can take back for those discussions. Ruth?
I can give it an update on that from just two perspectives. So the first one is from actually going back to that waste conversation. Costas wasn't in all the groups, so he hasn't seen all the feedback, but my group had a conversation about just that, and we fed back in that actually one of the things we think we should be looking at nationally is how can we be supported in community pharmacy so that actually we don't need to print that paper, because all essentially has happened with EPS is the printing burden's gone from general practice to community pharmacy, so that the environmental impact hasn't changed because we're still printing out all those bits of paper. So how can we be enabled under our regulations and to safely maybe have devices so we don't have to print things out, but somebody has the device so they can then dispense and assemble from that device rather than having to look at that original prescription. How can we do that legally and safely? So I think that was part of the conversation. That's one thing we were, again, I think it's going to need national change, but it's that we're feeding back in. And our Community Pharmacy West Yorkshire committee that we held last week, and we had a discussion about this as well. And one of our committee members also works for NHS Digital, and he outlined that there was a conversation around how they kind of look at the number of EPS items in each prescription, but there's quite a lot of impacts that have been highlighted that may cause by trying to reduce that and cram it all in, because actually the text will get so small we can't safely read it. So it is something that they're really mindful of. They haven't got a solution, but yeah, I think we need to work for it. And I just see something in the chat, so let me just get that. So Sarah says ProScript allows you not to print repeats, which is great. Not all pharmacy systems do that, but that could be something you want to think about in your own pharmacy. Actually, what does your pharmacy system let you do to help reduce that paper waste? Yeah, so don't know if that's answered it, but Reshma, but I do think hopefully that's, it is something we're cognizant of. But as Costa says, it's about how we get these changes to happen quickly so we can have a big impact.
Thank you.
Amanda.
When the GP surgeries printed them out, that like Reshma says, they printed out, if it was 8 items, they print out all 8 together with one set of repeats. Whereas when we do it, we get one set of 4 with a full set of repeats and another set of 4 with a full set of repeats. So I don't understand why.
Basically, the environmental impact of that's increased with EPS, sorry.
Yeah. But if they could do it with the GPs, when the GPs were printing it out, why does the prescription come through differently to us?
It's exactly what we want to be hearing, because we can then feed this into, we've got kind of representatives from Greener NHS that kind of link in with us, so we can be feeding this in, because there'll be people that won't even be aware of this. So we want to escalate these things.
So anybody got anything else I'd like to add? Reshma, that was a really helpful conversation. Thank you for highlighting that. And thanks, Sarah, for your messages as well.
Also, when you do take that conversation back, maybe if it would be possible to have an option of not printing the repeats if the patient doesn't require the repeat, if they're ordering digitally, yeah, they may be happy with a copy that they've already got or not even need one.
Yeah, because my husband orders it digitally. When he gets his repeats, they just go in the bin. So looking like there's no further questions, Costas, but I hope that was helpful from your perspective to get a bit of feedback. I'd like to say a massive thank you. That was really interesting. There's lots of, it's put into context for me, and I've been connected to the work you're doing, so I found it really, really helpful. So a very big thank you from me, and from, I'm sure everybody else that's attending. As I say, we're going to put this on, it's recorded, so it'll be on our website next week under our past events and resources. So please do share it with your pharmacy teams, because it might be something to help them think a little bit differently, and you might want to use this as a starter to have that team conversation that Costas recommended, to think actually what can we, has anybody got an idea to actually how we can make a difference, and bit by bit we will get there. So yeah, so please tell your colleagues and share it with other pharmacy teams. So thank you all very much. take care, look after yourselves, and we shall see you at our next event, which is next month, around advanced services. And we're actually going to talk about the how to deliver advanced services and the missed opportunity that if you don't deliver them. So yeah, we're writing that at the moment, so hopefully you'll find that helpful, and we'll see you there. Take care.